Episode 4 Shockwave Therapy for Pain and Performance Medicine. Hey, it's Adam Sewell, MD, and welcome back to the Medical Entrepreneur channel, where we help physicians build cash-based service lines that actually work in today's healthcare environment. In this episode, we're going to talk about a technology that's simple, safe, and incredibly profitable to add to your practice: shockwave therapy, also known as extracorporeal shockwave therapy. Shockwave therapy has been proven in multiple clinical studies to stimulate tissue healing, improve pain, and accelerate recovery in musculoskeletal and performance medicine. And best of all, it's completely cash pay, non-invasive, and easy to implement in under 30 days. So today I'll walk you through exactly what it is, the science behind how it works, which patients it helps most, how to choose the right device, how to price your sessions, and how to integrate it into your regenerative or pain practice. Let's get started. Section 1. What shockwave therapy actually is. Shockwave therapy uses focused acoustic energy to stimulate biological repair in damaged tissue. In simple terms, it's like using sound waves to restart the body's natural healing process. These high-energy pulses travel into the target tissue like a tendon, ligament, or muscle, and cause micromechanical stress that triggers cellular signaling, improve blood flow, and the release of growth factors. Clinically, it's been shown to reduce inflammation, increase local circulation, and promote regeneration of tendons, fascia, and even bone. There are two main types of shockwave systems you'll see. One, radial shockwave, which spreads energy over a broader area and is great for larger muscle groups. Two, focused shockwave, which penetrates deeper and targets specific structures like tendons or calcifications. Both have strong evidence. The key is matching the type to the indication. Section 2. How it works. The science made simple. Here's the simplified mechanism. When shock waves hit tissue, they generate mechanode transduction, mechanical energy turning into biological activity. This triggers local release of nitric oxide, vascular endothelial growth factor, and TGF-beta, leading to angiogenesis and collagen remodeling. It also stimulates nerve regeneration and reduces substance P, a neuropeptide involved in chronic pain. In short, it decreases inflammation, restores normal tissue structure, and improves function. Think of it as a mechanical way to reboot a tissue's healing signal. That's why it pairs beautifully with regenerative injections like platelet-rich plasma or amniotic cytokine therapies. Section 3, the evidence. What it's proven to help. Shockwave therapy has been studied in hundreds of clinical trials. Strong evidence supports its use for chronic plantar fasciitis, tennis elbow and golfer's elbow, patellar tendinopathy, shoulder calcific tendonitis, greater trochanteric pain syndrome, Achilles tendinopathy, myofascial trigger points, erectile dysfunction of vascular origin, delayed bone healing and stress fractures. In orthopedics, urology, and sports medicine, it's recognized as a first-line, non-invasive regenerative therapy before surgery. And while not every insurance plan reimburses it, that's actually an advantage because patients already expect to pay out-of-pocket for results-driven treatments. Section 4. Ideal patient profiles. The best candidates are patients with chronic tendon or ligament pain not responding to physical therapy, athletes who need fast recovery without downtime, post-regenerative injection patients where you want to amplify the biologic effect, older adults with degenerative tendon changes who want to avoid surgery. You can easily integrate it into orthopedic, pain management, sports, or regenerative medicine programs. Section 5, how to add it to your practice. Here's your 30-day implementation plan. Week 1, research and choose your device. Top medical grade manufacturers include Storz, Zimmer, and Chattanooga. For a single provider clinic, a high-quality radial system costs between $15,000 and $25,000. Focused systems can range from $30,000 to $50,000. Week 2, train your staff. Training is simple. 1 or 2 days of hands-on sessions to learn energy settings, treatment protocols, and safety. Week 3, develop protocols for your top conditions. Example, plantar fasciitis, 2,000 shocks, 2.5 bar pressure, weekly for 4 to 6 sessions. Lateral epicondylitis, 1,500 shocks, 2.0 bar, weekly for 4 sessions. Week 4, market your launch, use educational videos, case studies, and before and after mobility clips. Patients love seeing technology that looks advanced but is easy to experience. Section 6, combining shockwave with regenerative medicine. One of the smartest ways to position shockwave therapy is as a biologic activator. You can use it before or after regenerative injections like platelet-rich plasma, alpha-2 macroglobulin, or placenta-derived protein arrays. For example, before injection, increases blood flow and primes the tissue for biologic absorption. After injection, re-stimulates healing and helps maintain tissue remodeling over time. This combination approach can dramatically improve outcomes and gives your clinic a clear differentiator from typical med spas. Section 7. Pricing and profit model. Let's talk numbers. Most clinics charge $125 to $200 per session for a single treatment area. Packages are typically $600 to $1,000 for a 5 to 6 session plan. The cost per treatment session, including device amortization, is usually under $10, which makes your margins extremely high. Here's a simple example. If you perform 50 sessions per week at $150 each, that's $7,500 per week, or roughly $30,000 per month in added revenue. And because it's quick, 10 to 15 minutes per session, it integrates seamlessly into your existing schedule. You can delegate most sessions to trained staff under physician supervision. Section 8. Compliance and safety basics. Shockwave therapy is FDA cleared for certain musculoskeletal conditions. It's considered non-invasive and safe when used properly. Just remember, always obtain informed consent. Avoid over bone plates, open wounds, or in patients with pacemakers. Document each session's parameters and response. Don't advertise it as a guaranteed cure. Emphasize tissue healing and functional recovery. If you combine it with biologic products, maintain proper documentation of each component's intended use and compliance with FDA Section 361 guidance. Section 9. Common pitfalls to avoid. Here are the top mistakes I see. Number 1. Buying a cheap consumer-grade device online. These often lack proper calibration, energy accuracy, and clinical depth. Use only medical-grade systems with FDA clearance. Number 2. Treating too aggressively. Start low and increase gradually. Pain relief comes from signaling, not tissue damage. Number 3. Marketing it as a magic bullet. Shockwave therapy is powerful, but best when combined with movement rehab, biologics, or metabolic optimization. Section 10. Positioning and messaging. Your message should be simple and clear. Shockwave therapy helps your body heal itself without drugs, surgery, or downtime. That's what patients respond to. Use before and after mobility videos, testimonials, and 30-second Instagram reels showing real treatments. Patients are drawn to visible technology, and the sound of the Shockwave device itself signals advanced medicine in a way that few treatments can match. Section 11. Closing and next steps. Let's summarize your action plan. 1. Choose your Shockwave device and verify FDA clearance. 2. Create 3 to 5 standard protocols for your top conditions. 3. Bundle it with regenerative or performance packages. 4. Price it as a premium, fast results therapy. 5. Market with education and evidence, not hype. If you'd like a free downloadable checklist that includes sample treatment protocols, recommended devices, and pricing templates, grab it from the link below. This is Adam Sewell, MD, and you've been watching the Medical Entrepreneur channel. If you're ready to grow your private pay practice with regenerative and performance-based treatments, hit subscribe and I'll see you in the next episode where we'll cover photobiomodulation and red light therapy, the new frontier in pain and nerve repair.